The main disease which is linked to silica dust exposure is silicosis. Although silicosis is a serious lung condition, it is an entirely preventable occupational lung disease. I'm Dr. Sugeesh Pathirana. I'm an occupational physician working for eye care, dust disease care. When a worker cuts, grinds or drills into materials that contain silica, tiny silica particles are released into the air. As the worker breathes, silica dust particles flow down the air passages deep into the lungs. The immune system in the lungs recognizes these particles as foreign, and this process triggers an inflammatory reaction which unfortunately leads to scar formation. The lungs become stiff, hard to inflate, and it also becomes difficult for the oxygen to exchange into the bloodstream. If someone has silicosis, they may not have any symptoms at all at the beginning. Over time, they have symptoms such as irritating cough, excess mucus, and difficulty in breathing. When the disease is more advanced, the symptoms can get more serious, such as weight loss, fatigue, fever, and chest pain. Silicosis is a very serious lung disease, and it can be progressive, disabling, and sometimes fatal. Once it is established, it is impossible to reverse the damage to the lungs. At this stage, there is no cure for silicosis, but there are treatments available to improve your symptoms and quality of life. There are some medications to relax your airways and reduce the scar formation. Some people may require oxygen therapy if they can't get enough oxygen into their lungs. So lung transplantation is an option, but not everyone is suitable for that type of treatment. People who are at risk of exposure to silica dust are those who perform high-risk activities such as polishing, grinding, cutting, and drilling with materials containing silica. It is estimated up to 600,000 Australian workers are currently exposed to silica dust. As we know, silica was brought onto focus in recent years due to the outbreak of engineered stone workers diagnosed with silicosis. Apart from the engineered stone industry, workers in tunneling, construction, quarrying, mining, demolition are at increased risk of exposure to high levels of silica dust and developing silicosis. Lung screening is the key to identify if someone has silicosis or another dust disease. In New South Wales, employers are required to provide lung screening to workers who work in workplaces with hazardous dusts. iCare provides lung screening services to employers as a subsidized service. We also provide free lung examinations for those who were employed in an industry where they were exposed to dust in the past or who are retired. The main message is, although silicosis is a serious lung condition, it is an entirely preventable occupational lung disease. It can be prevented through minimizing or preventing you getting exposed to this hazardous dust in your workplace.